of participants filtering in, which is brilliant. My name's Isabel Rice. I work for Sustain and I coordinate the food poverty work here, both locally and nationally. Just like to say a really warm welcome. We're so pleased that we've had so much interest. We've had lots of sign-ups today. So we will be recording today's session for anyone that wanted to attend and wasn't able to, and we will share that afterwards, as well as sharing the slides. Just a note that we're running today as a webinar. So if you're not one of our speakers and panelists, we can't see you and we can't hear you just because there's so many of you, which is great, but you can use the chat function. So you should see at the bottom of your screen a chat box, which you're very welcome to introduce yourself, tell us who you are, tell us where you're from in the chat. There's also a Q&A box that you should be able to see, and we will have a chance after we hear from our speakers today to ask some questions of the panelists. So if you've got any questions, feel free to add those as we go through. We won't answer questions at the end of each speaker. We'll come to those as a panel at the end. And if you click on the more ... button, you should see there a CC function. So if you'd like to, that will let you bring up subtitles today. So welcome again. Thank you so much for your interest in today's session. We're going to be talking about the new Crisis and Resilience Fund and the opportunities this holds for the charitable food sector. And just to say, we'd like everyone to feel really safe and included today. And we'd like to have respect for the different points of view and expertise that are in the room. So that includes the speakers, but also in the chat and the Q&A box. Please be mindful of different points of view and avoid using any outdated cultural references or colloquial language. And we wouldn't tolerate any sort of abuse or discriminatory language. So please do contact myself or Lulu if you've got any questions about that or any concerns. You can message us in the chat. So without further ado, let's get into today's session. So I'm going to start very briefly with just a bit of an overview of what we're going to talk about today. We've got a brilliant... Oh, sorry, has my slide moved along? Yeah,
Yeah,
brilliant.
all good.
This is what we're going to be talking about today very briefly. We're going to be hearing from the Independent Food Aid Network about the new CRF guidance. We're going to be hearing from the Alliance for Dignified Food Support about their place-based work towards food bank places. We're going to be hearing from Trussell about the work the communities team are doing with their network. And then we'll be hearing from some frontline providers who are doing fantastic work, both from North Paddington Food Bank and the First Love Foundation. And then, as I said, we'll have a chance to ask some questions before we close. So just to start us off very briefly, I'm going to stop sharing my screen for a moment, and my colleague Lula is going to pull up a Menti. Now, whilst Lula is pulling that up, and we can also pop the link to that in the chat. If you've got your phone, you can scan the QR code that's coming up, or you can also follow the link that's going to come through in the chat. So just to start us off, before we kick off with all the presentations, and brilliant to see so many of you introducing yourself in the chat. That's fantastic. You can follow that link that's in the chat there, or you can scan the QR code on your phone. So Lulu, if you just go along to the next slide, we'd just love to know, and thanks for those introducing yourself, we'd just love to know who we've got in the room today and where you're from, just to have an idea of colleagues that are here. So if you're joining us from a council, from a food partnership or network, from a frontline organisation that's delivering food support, academic, a national or regional wider charity, or somewhere else. Okay, great to see we've got a bit of a mix of people here today. Lots of frontline providers, but also councils, charities, food partnerships. Great to see. So just to give everyone an idea of who we've got here in the room today. That's great. Thanks so much, everyone. And if you stop sharing now, Lula, I'm going to pull the slides back up and get started with our presentations and speakers today. So hopefully you can all see that. Can you see my slides? Great. Thanks for the thumbs up, Lula. So I'm sure many of you here are familiar with the new Crisis and Resilience Fund. A very brief overview. This is 3 years of funding that has just kicked in from April that will go to local authorities to allow for planning and strategic work, and it's replacing what was the Household Support Fund, which provided much shorter term support, and this was focused on mostly on emergency food provision and holiday voucher spend. And it incorporates the discretionary housing payments, which were separate now altogether under the fund. And this links to the government's manifesto commitment to end mass dependence on emergency food parcels. Some really key things within the guidance are that there's a focus on being person-centered and trauma-informed, so thinking about what's best for the person, each individual person, and that it needs to be accessible. So there's multiple routes of engagement, and we're thinking about things like barriers to engage and digital exclusion and things like that. There's three key outcomes there. I won't read through them all, but anything that's funded through the fund needs to work towards one or more of those. So what do we mean when we talk about the CRF and the cash first approach that the guidance is recommending, and how that links to food and food insecurity? So ultimately, a cash first approach would mean that people's incomes or social security payments actually match living costs so they can afford essentials like food without falling into crisis. But also this means that when a crisis does happen, there's cash first payments alongside advice to maximize incomes and other important types of wraparound support that are person-centered on what that person might need. Also thinking about prevention, so not just crisis support, but building financial resilience and supporting people so they don't fall into crisis in the first place. And this builds on the evidence that cash payments are preferable to and more effective to most people who are experiencing a financial crisis, but that support should be delivered flexibly. So while there's a cash first approach, this doesn't mean cash only. And again, this links to being person-centered. So other types of support like furniture vouchers or food or other essentials might be better options for that person. I'm now going to hand over to my colleague Sabine, who is going to give us a bit more detail.
Hi everyone, I'm Sabine Goodwin, the director of the Independent Food Aid Network, and I found like Sustain and Trussell and many other anti-poverty charities as part of what's called the Crisis Support Working Group, and we participated in the co-design process that the DWP ran in putting together the CRF guidance. So how might charitable food aid providers and community food organisations be funded? The two second and third outcomes are key to this. So improving individuals' financial resilience and bolstering local community networks of support to help do just that. Resilience services are defined as the services, programs and activities which support building individuals' financial resilience. And they are encouraged to, as you see here, deliver budget maximisation, income smoothing and financial capability support. So strategic work that resilience services could undertake could involve wraparound services such as advice and support to help maximise income, and that could definitely include funding staff times. Local authorities are encouraged to think creatively about new approaches to building sustainable food landscapes, which draw on established best practice and support people to transition away from crisis support to build their financial resilience. An example of this might be a food bank transitioning to distribute cash payments or shopping vouchers instead of food parcels, alongside advice and support to maximise income. And we're going to be hearing from the North Paddington Food Bank, who've done just that in a moment. Next slide, please, Isabel. Thank you. And helping individuals build financial resilience is measured in the following ways. Resilience services are expected to positively impact on one or more of the following outcomes. I won't read them out, but that's the idea that really all of these at least one of these outcomes would be covered by the resilience services. I'll hand back to you now, Isabel.
Brilliant. Thanks for adding a bit of detail there, Sabine. Okay, I'm now going to bring in Steph Lake from the Alliance for Dignified Food Support, who's going to talk about the work they've been doing. Thanks, Steph.
Thanks, Isabel. Just going to share my screen. Can you hear me and see the slides okay?
I
Yep.
can.
Brilliant, thank you. Hi, I'm Stefan. I'm from the Alliance for Dignified Food Support, and I wanted to talk to you a little bit about a campaign that we're currently putting together, which is called Working Together for a Food Bank Free Britain. And um, we are aware that the campaign name is quite provocative, it could be quite confronting, and I'll talk about that a little bit more as we go on. Um, but this work, very briefly, came out of a couple of pieces of research that we have done. The first into hunger trauma, which is around the impact on people who are accessing emergency food aid. And the second was the impact on staff and volunteers. And so we did extensive interviews and questionnaires with volunteers and staff from across the sector. And we heard lots of people talking about the burnout that they were experiencing and the ways in which how they were able to behave and operate within the context of their organisation did not match up with their own morals and values, and especially since demand on their service has continued to increase, but the availability of redistributed surplus food and donated food has gone down, meaning that lots of volunteers and staff have been asked to make really difficult decisions about who they're able to support through emergency food parcels, and the impact that that has on them. Central to the campaign that we are running is this idea that how we respond to poverty is not inevitable. And we have had lots of conversations with people about the institutionalization of emergency food aid and how it's become very much part of the landscape. And I think that we are in danger of sometimes thinking that until we have solved poverty, we can't start working on ending the reliance on emergency food aid. And so central to this campaign is that that's not the case, that cash first approaches provide a really good alternative alongside community resilience building and all the stuff that Sabine has already talked about. And then the third thing that's central to the campaign is ensuring that any approach to ending reliance on emergency food aid is flexible and place-based, which is why I'm going to talk for as briefly as possible, because it's much more important that you hear from our speakers who have been doing this work and who have had success and can talk to you a little bit about how they've done it. But what works in one place might not work in another. So this has got to be bespoke and place-based. So again, this is like a real top line summary, but the Food Bank Free Britain campaign is going to be about building a movement committed to doing things differently. So as Sabine has already outlined, it's going to mean prioritising cash first support for people in crisis over giving out food parcels. But it's also about building those advice and specialist services that create resilience. And then we also believe that there is a place for open access projects that involve food, but they need to be sustainable and open to everybody as opposed to a form of emergency food aid. Again, if I had more time, I would go into that in a lot more detail, but this is just a top line summary.
Just one
So
minute, Steph, if that's okay.
yes, so really briefly, these are the calls to action that were developed through a series of workshops that we ran last autumn. These are calls to action primarily aimed at local authorities and local government to call on an end to mass reliance on emergency food parcels by developing clear exit plans, by taking back responsibility for people in crisis, respecting the limits of emergency food aid, and ending reliance on volunteers. As part of our campaign, we are going to be developing lots of different resources. And I'll talk really, really briefly then to say that this is the campaign slogan that we are going with. We understand that it's provocative. It's not aimed at demonising food banks, who we know have been doing incredible work. But through testing this slogan, we know that this is something that lands really well. It's a strong, tangible ask that lands well with local authorities and MPs, because it's something that they can say that they are doing. And we're hoping that it creates a bit of a race to demonstrate that this can be successful. So if you are interested, we have our campaign launch in July. The QR code will take you to the Eventbrite page to sign up, and I'll put it in the chat as well. And yeah, we'd love to have as many of you on board as possible. Thanks for your time, and thanks Isabel for having me.
Thank you so much, Steph, for that. We are now going to hand over to Polly Jones from Trussell to talk about the work their communities team is doing with their network.
Thanks, Isabel. Lovely to be with you all, everybody. I'm Polly Jones. I'm the Director of Communities at Trussell, and many of you are joining the call from Trussell Food Banks or organisations that work with Trussell, so we won't be unfamiliar to you. We're a UK-wide anti-poverty charity operating in about 1,400 locations across the UK, but our vision is very clearly to end the need for food banks and charitable food aid. We really welcome the Crisis Resilience Fund because a cash first, not a food first, income maximising approach is something that we have long championed and advocated for. And we believe this approach is essential to ending the need for charitable food aid. I'm sure it's something many of you would agree with. Since 2019, when Trussell first committed to working towards ending the need for food banks, we have been investigating and testing in lots of different ways with lots of different food banks and at different scales what is needed to do this. And that is really shaping our work today, which is what I wanted to share with you. So we've learned a lot about who is coming to food banks and why people can't afford food and other essentials. But just to be really upfront and straightforward, that this is an issue of food insecurity and food bank use is an issue of extremely low income, a problem of income and not a problem of food. We know that on average, people who come to Trussell food banks have about £104 a week after housing costs. But the vast majority of people that we engage with have no savings at all and are in many types of debt and arrears. And just to kind of contrast that with the amount you get as part of the standard allowance for universal credit, which is £98 a week from this month, you can already begin to see why people are struggling to afford food and other essentials. So we know that food bank need is not driven by poor cooking skills or budgeting, and that if you're in receipt of social security, especially universal credit, you are much more likely to not have enough income to cover the costs of essentials, including food. We also know that lots of people can't escape higher costs or a poverty premium. And from our really kind of comprehensive data, particularly parents of young children, people who are renting, people with long-term health conditions are far more likely to experience food insecurity and disproportionate need to turn to food banks. So we know a lot about who might be in this situation and who we want to make sure that any of our action, including with the CRF, will have a positive impact on. But we've also built a really big body of evidence about what can be done, which we're really laser focused on delivering. So upfront, because we know this is an issue of income and a failing social security system, we know the heavy lifting needs to be done by our social security system. And we have been spearheading a campaign to bring in an essentials guarantee, which would put in law a legal minimum that social security must provide somebody, which would be enough to cover essentials. And we would love you to join this campaign. But doing that work on social security is not enough on its own. One of the other big areas that we've learned a lot about in our research and investigations and from practical work on the ground is about how difficult and confusing it can be to access social security to which you're entitled. So 1 in 3 people come into a Trussell food bank haven't received any advice before they have to come to the food bank, and 1 in 7 in England haven't had any support from a local crisis scheme, which tells us a lot about what we might want to improve on with the CRF and with other action. So we have been focusing a lot on really helping people access income maximisation support and ultimately social security and other kinds of cash and income support. Over the last few years, we've provided about £40 million to enable what is now 92% of the Trussell Food Bank network to offer free and accessible money and debt advice in a food bank, but also around a food bank. It's had massive gains for people in terms of money in their pocket. But I think the thing I most want to share with you is really what we've learned about how we can make advice more effective for people experiencing food insecurity.
Just one minute, Polly.
Yep, thanks, Isabel. Thinking about how we provide advice in informal settings, how we try and provide continuity, not just a one-off appointment, how we think about advice that is multifaceted and connected to other services. And through this work, we've seen 40% of people not needing to return to a food bank. So we know that we're onto a winner. This is a good approach. The other key thing I think I want to share with you just lastly is how we've learned huge amounts about the positive benefits of food banks working with local partners to really provide cohesive, quick advice and access to advice and support. And where we've seen food banks working with local partners to co-develop pathways to cash and advice all across the UK, thinking about using the collective expertise of local services and avoiding duplication. Again, we've seen a 20% reduction in people needing to come back to seek food aid. And the Crisis Resilience Fund is a significant opportunity to really build on this and strengthen local partnerships that reduce the need for charitable food aid. So there are three last points, I guess, just to leave you with. As a representative from an organisation that works with a community of food banks, we really urge you to use the Crisis Resilience Fund to move away from a food first approach to a cash first approach. This is a fantastic opportunity. While you're developing your plans that kick off in July, the timetable we know has been extremely tight. But I think some of the most exciting work we've seen has been where local authorities and local organisations have put plans together for the first year, leaving you space to improve and develop that as you learn more about what you want to do over the next 3 years. And very finally, Trussell really wants to learn from you, to share what we're learning with you and to work with you. So if you're interested in anything that I've said, please get in touch. I can pop my email in the chat if you're not getting all of our emails at the end. We'd love to connect you with local food banks to support you to develop partnerships. And we have a programme of events to share best practice that you'd be very welcome at. Thanks very much.
Wonderful. Thank you, Polly. Loads of great information there. If you want to pop anything in the chat, please do. Right, I'm really pleased to now hand over to hear from some of our frontline delivery speakers. So next up, we've got Tom Delap. He's the manager at the North Paddington Food Bank. Over to you, Tom.
Sorry, I was on mute. Hope you can all see my slides. I'm just going to give a quick overview of a timeline as our journey as a food bank over the last few years model. So in 2014, just over a decade ago, we were started by a small group of local volunteers, which I'm sure many sort of the same story for many of the food banks that are on the call. And we began as a very small community response to growing food insecurity. But demand grew rapidly, and we soon became a lifeline for thousands of households across Westminster. So we went from supporting 520 households in 1 year in 2015-16 to over 15,000 households supported during the pandemic. While the pandemic did accelerate demand for everyone across the UK, the cost of living crisis that came shortly after it did continue to deepen it. And we all know about the rise in energy costs and high rents, and the gaps in the welfare system, which has already been covered, were pushing more people into crisis, and they were staying there for much longer. At the same time, this was happening, volunteer capacity and food donations decline, and it became clear to us that a traditional model of sourcing, sorting and distributing food was no longer enough to meet demand. And it led to a critical shift for us in our thinking that food insecurity, which we know now is not a food problem, it's an income problem, and it requires an income-led solution. So in 2021, we made a bold shift to stop giving out food, and we moved towards a cash first approach. We started with supermarket vouchers initially, and then within 6 months of delivering that and testing the impact and doing lots of surveys of our community around what would they prefer, vouchers or cash. Cash obviously came out as the preferred choice. So we decided to launch what is, I think still is, the UK's largest cash first pilot. And the sort of the main driving factor for this was moving towards a dignified choice for individuals to decide what food and essentials best met their needs, but combining that service with financial support and combined tailored advice services. So over the period of 3 years, we partnered with Turn to Us and delivered the pilot. So it was a pilot of £330,000 to 150 households. Each household received a grant of 2,200, and it was tracked over a period. Each household was tracked over a period of 12 months. So 6 months before, well, longer actually, it was 18 months. 6 months before, 6 months during they received the grant, and the 6 months after. Some households received it as lump sum payments, some received it as structured weekly or monthly. We wanted to test different payment models and what type of cash grants work better, and trying to sort of mainly replicate regular income. The sort of over key headline results from that is we saw a 79% reduction in long-term food aid dependency, and 53% of households who took part in the pilot have not needed to return to the food bank again, are financially resilient. We obviously published these findings at the start of the year, just before the CRF funding came out, so quite a pivotal moment in the direction for Cash First. And part of in terms of who we supported those that were most dependent on food aid and most affected by the cost of living crisis, which you can see there, but I won't go through it because I know I've got a short amount of time. But generally the types of households that are accessing food banks. This is just in terms of distribution. Simple, not complicated, lump sum payments, direct bank transfers, and then the structured and weekly payments used a system called Cash Perks, which allows you to withdraw cash from a cash machine. And then what households spent with their cash, which is again an often thing that comes up often in terms of what do people do with cash when you give it to them. When given financial autonomy, overwhelmingly people did prioritize essentials and chose to spend locally, which I thought was a really big finding. Shopping in local markets, supporting local businesses, and often getting better for value for fresher food and more culturally appropriate food. 100% of people who received structured weekly payments or monthly payments part of the pilot used it for food and bills. 77% of lump sum recipients used it for bills, whereas a large portion of them used the lump sum payments to clear priority debts, or essential furniture, large purchase items. So that was kind of the main key finding, that structured payments smooth spending over time because it kind of replicated regular income. Households weren't often in crisis, whereas lump sum payments are often absorbed by urgent arrears or one-off crisis costs. So we've based on the findings of that, we have now sort of designed and delivered our own crisis scheme, which is based on sort of regular structured payments over the period of time that keep a family or an individual not in crisis, whilst all of the important work around income maximization, financial resilience can take place. And then hopefully after a period of 6 months of those two combined, we'll get really positive outcomes. And in more than half of the cases of people we work with, we have the most important outcome, which is they don't need to use a food bank again.
That's 1 minute more, Tom.
Okay, great. And then in terms of a bigger shift, in terms of reimagining what food banks look like, we opened the Exchange a year ago, which is what we think what a Cash First food bank can look like, or what all food bank sort of spaces that are sort of dedicated purely to sort of sourcing, distributing food could become. So we redesigned our space with the community in terms of what they needed, the services they wanted to see. The community helped design it, shape it, build it, and we now have an amazing space that, yes, people do come for Cash First support. The advice and support services are there. It's all sort of built in, route training, employment, workshops, but it's also a space for connection, culture and wellbeing. And it is our exit strategy when we no longer need to access as a crisis service. Will still be a very valuable community source for the future. So it's kind of, the Exchange is our exit strategy. And I think that is me to stop sharing.
Brilliant. Thank you so much, Tom. That was fantastic. And I know some people are asking, we will be sharing the slides afterwards, so you can look through those really brilliant findings there. I'm now going to hand over to Francis Ikamasuna, who participated in North Paddington Food Bank's Cash First pilot and now works at the food bank on Cash First communications and policy work. So over to you, Francis.
Thanks very much, Isabel. So I'm Francis. I'm a mother of 3 children. Their ages are 5, 8, and 13. And I'm also a full-time carer of my elderly parents. So my story is I'll start from the beginning. I started off, I was working in structural engineering, and had a very good job, and I was able to live a very good, decent kind of average life, and, things was great. Then unfortunately, I had a breakdown in my marriage, and then I quite quickly found myself single parent, 3 children, and aging parents. The money that I was getting in my salary, although it was a decent salary, it wasn't enough to cover childcare and wraparound care for all of my kids, and quite a stressful, intensive job that I had. And as my parents were aging, I didn't have the support to work long hours, work sort of at the last second, kind of be darting out of the door to do things in the firm that I worked for. So I decided I had to then take a step back from work so that I could provide care to everybody and try to manage the household in that way. But as my parents as their health was declining and I was able to do less around the house, my focus was shifting, and I then suddenly found that we were in the middle of COVID and the rising of cost of living, and my financial situation started to decline. And I was kind of getting really concerned with how we were going to live, how we were going to cope. And fortunately, another mum who was going through a similar experience had already visited the food bank. She saw that I was trying to navigate universal credit process, and I just felt at the time I was just banging my head against the wall. I looked at myself as hardworking, intelligent. I thought I could navigate the system, I could get us back on track, and it just wasn't working. So she spoke to me and advised me to go to the food bank. And I kind of felt challenged by that initially because I'd never needed support. I was always able to take care of myself, take care of my children without having to go to any external agencies. But in the situation that I was in, I realized that the climate of the time, things weren't going to improve. So I needed to do something positive to see what support was available to me. Very nervous, very unsure, I approached the food bank, and to my surprise, I was really welcomed by the staff. I was met by Tom and some other members, and they kind of just sat down and listened. I didn't feel like I was being judged. I didn't feel like I was, my intelligence was being questioned. They just opened the door, allowed me to come in, and then just really sat down and listened to my situation, and offered me a lot of support. Over time, that developed into them approaching me to see if I would wanted to participate in the Cash First pilot, of which I jumped at the opportunity, because trying to go through a system where you have to make a referral to try to get a voucher, to then that voucher is very specified and where you can shop. I'm trying to support 6 people in my household, and you're trying to manage everybody's varying needs, and you're trying to keep everybody happy and trying to maintain life as it was previously. And to do that, and you're only kind of directed in one place, you can't shop locally, you can't buy the foods that my parents, for example, may like to eat. And everything felt very challenging. And so when I was asked to join the pilot scheme, I was really overjoyed to do it, because it meant that firstly, I was seen as a person. It was a very dignified process. I wasn't, kind of questioned or made to feel like, I had to check in to, explain myself all the time. It was just like, yeah, we see what you're doing. We see you. We appreciate what you're doing, and we want to help you, we want to offer you support. And without any strings or any kind of, feeling like I was being supervised. And it was really freeing. It was really liberating. It helped me support my family directly. I didn't feel the need. I'm not the kind of person who, if given support, I would use it frivolously. That wasn't me anyway, even when I was working, and particularly now, the times, you're really being very careful about your budgeting. You're making sure that you can support my children's needs, my parents' needs. And so when I was given that, when I was joining the pilot scheme, I was able to do just that. I could pay our bills, I could take care of the food, I could take care of the uniform, and I wasn't having to be constantly chasing my tail and checking referrals and speaking to the different agencies and being passed around and having to explain myself over and over again. So that in itself was just a really amazing opportunity. And having stayed in contact with the food bank because of the pilot scheme, I saw when they created the exchange, they were offering opportunities to upskill yourself. And I looked at my situation, I thought, well, I'm not going to be able to do the regular 9 to 5, but I'm still want to function. I still am really interested in learning and developing myself and keeping my skills up to date and relevant. And so I saw a socialpreneur course here, which developed social media skills, content creation, digital editing. And I thought, yeah, that's a skill that I could learn, I can develop it, and I can use that to help myself and my family. And it's done just that. You know, the resilience side and the income maximization side of working with the food bank has meant that I've been able to develop skills and have that kind of long-term outlook to change my situation and to give me something that I can now use in the future. Unfortunately for me, I think because the food bank saw that I was really willing to make changes and I want to work hard to get into a better situation and a more sustainable situation for my family, I've now been, offered a position to work as a communications lead and a policy lead to help inform and shape and to deliver cash first and different approaches to that, and use my own experience to advocate and to talk on behalf of others who may not be able to or comfortable enough to do so. So I think having gone through the process of, being quite independent and then having to become dependent, I've now kind of been able, with support, to not only build like a sustainable financial situation, but create the mind space to be able to upskill myself and create a whole new avenue for us and a way out for us to kind of not have to go back to the position that we were in previously. So, my sincere gratitude goes to the food bank and to the staff there, because they never at any point in time made me feel like I was, not meeting expectations. I wasn't delivering. I wasn't doing such. They really supported me and helped me and allowed me to kind of find my confidence again, and now create a whole nother path and avenue for myself. So I think the work for Cash First approach is really important. I think it changes lives. I think it helps people to maintain good mental health as well, which is really important, particularly if your circumstances change, but you are caring for others. You don't always want to be feeling depressed or feeling like you can't cope. You want to feel like actually there is a way out. And it's really important, the work that Cash First has done for me and my family. And I think I think I could speak quite confidently to say other people would really benefit from having an opportunity as the one that I've been given. So I would really advocate it, yeah.
Francis, thank you so much. I didn't want to interrupt you there. For everything you were saying was absolutely brilliant. Is there any final comments you want to make before we hand over?
Just to support what's been said, what's been raised, that yes, the income or the vouchers or the money helps, but the other side of it is the resilience and being informed and told. Because I thought I knew the universal credit system, and when I sat down with the income max officer here, I realized I knew absolutely nothing. There were so many hidden entitlements that I had, that my parents had, that I didn't know about. And for a long period of time, I was pretty much struggling when I really didn't need to, because there was at least a little something here. There was another benefit there that I had absolutely no idea about. So I think that's probably quite a common thing, that people are underinformed. So having the income maximization is really vital to back up and give people and open people's eyes into what's actually out there, what they're entitled to, and not to feel like they should be afraid to ask for it, because it's what they're actually entitled to, and they're not supposed to live such a stressful life, that there is actually support out there. And then once they've built up a whole new set of skills, or they've been given opportunity to do so, then actually you can change your life completely and not have to ever look back. I think that's just an amazing gift to give somebody.
Oh, Francis, on that very inspiring note, you have perfectly teed up our next speaker, who is Denise from First Love Foundation. Could I hand over to you, Denise, to speak about your work?
I'm not sure for the first time in my life how I'm going to follow that. Well done, Francis. It's very, very inspirational. But look, thank you for inviting me along to share our story. I'm going to be as quick as I can so we can jump to questions and things like that. Right, so I'm Denise, and I'm here to share our journey about how we moved from running the food bank to delivering wraparound support. And I'm hoping that maybe offer some learning, some encouragement, some inspiration, particularly as we respond to the direction set by the Crisis and Resilience Fund. So, we're based in Tower Hamlets, and it's an area of great vulnerability, highest levels of child poverty. But yeah, vulnerable adults is basically, what we've had to learn how to respond to in terms of need. I launched a Tower Hamlets Food Bank back in 2010. And at that point, based on some research that I'd undertaken before opening, the need was obvious. People had no money, they had no food, they were in crisis. And by the time we opened, people would come along for food, but almost straight away start talking about something else, a benefit decision they didn't understand, bundles of letters they were afraid to open, rent arrears, and I could go on. But it soon became clear to me that food poverty wasn't really the problem. It was more a symptom of something else having gone wrong. There's one experience in those early days that really brought it home for me. I'd met a mum of two. She had successfully challenged an incorrect benefit decision and she was awaiting the payout. So in the meantime, she'd been relying on food projects across East London to get by. When we sat down to speak with her, we discovered that she'd been waiting 12 years. 12 years. And it wasn't because the case was complicated, not because it simply drifted. Her records had been discarded over time, and with no follow-up, there was no resolution. She said something to me that stayed with me ever since. In all the time I've been going to food banks, no one ever asked me what was wrong. You're the first. So yes, whilst emergency food helped us to survive those years of deprivation, without access to advice and advocacy, and someone just taking responsibility for resolving the issue, a problem that was completely solvable had been allowed to carry on for 12 long years. So yes, I learned that early help works, that when people can access the right support at the right time, crisis can be resolved and households stabilize. But I also learned another important lesson. Signposting alone doesn't, at least not for the people in the middle of crisis. Many people just do not have the headspace nor confidence to navigate complex systems like universal credit and benefits in general. They can't navigate it on their own. And being told where to go often meant that they didn't go at all. So then the crisis doesn't get resolved, it becomes cyclical, and people return time and time again. And before long, emergency support evolves into long-term dependency. So I knew it would take going beyond food to gain an understanding of the crisis if we really, really wanted to help. So back in 2011, I embarked upon designing what would become a kind of rapid, multidisciplinary advice hub embedded along the food bank. It's called what we call wraparound support at the time. And every person that came in, they don't undergo a triage with a project worker at the entry point. And their role was to simply listen, make sense of what was happening in the household, and then just work out what needed to happen next. But there was another important lesson that I learned. I didn't have the expertise to deliver advice in any way, shape, or form. We couldn't and shouldn't therefore try to do this alone. Expertise was needed. So our partnership, and we worked in a kind of integrated way, as in, we've tried to form this kind of helicopter view of the family, the household, and their issues to try and work together to resolve them. And those partners consisted of expert benefit advisors, the local authority housing benefits team, Job Centre Plus, believe it or not. And by maintaining that helicopter view, coordinating responses, ensuring problems were resolved rather than simply being referred on, we provided continuity of support until case closure.
Just one more minute, Denise.
Okay, so I'm going to be really quick. Okay, so we left the device instead of food, and the outcomes spoke for themselves. Average household income increased by £10,000 a year. 2/3 of people had their issues resolved in one visit, so therefore no longer reliant on food support. Engagement was high, appointments really missed, and over time, something else changed. more and more people asked to be referred just for advice and not food. So we gained, I'm going to skip along, we gained accreditation to deliver advice ourselves, and then we closed the food bank in 2022. And today, we deliver holistic advocacy, specialist legal advice, um, and just by way of impact, in the past 2 years alone, 1,400 people have been supported from 500 households, resolved 900 complex cases, secured £1.4 million in welfare support that they were incorrectly denied. I haven't got time to go into the other outcomes around work, training, self-advocacy, but put simply, lives have been transformed. So, in closing, if there's one practical piece of learning that I could share from our journey, it's this. Start by being really clear about the problem that your community faces and that you want to solve. Take the time to understand. And if you want to go down the same kind of road that we did in terms of advice, I would say partner with an organization that delivers advice as your first step. And whether you choose to partner with an advice organization or work towards delivering some form of advice yourselves, good governance, strong compliance, and place a laser focus on strengthening your charity and its own financial resilience, because it's necessary to continue this work. So in closing, yes, whilst emergency food played an important role, advocacy and advice became our front door, and through that we saw lives transformed. You can choose a different approach, whatever it is, but as long as it gets us to the same destination, and I'm hoping that through this fund, the Crisis and Resilience Fund, is going to help you begin the journey to bring about much needed change, transformation, and financial resilience in the lives of people you serve. It's going to take some bravery, but I believe you can do it. So well done to the design, and well done to you all for all the work you've done so far on it. That's me.
Denise, thank you so much. Really inspirational, and a huge thank you to all of our speakers. I really enjoyed that. Glad I got to sit here and absorb. Thank you so much for sharing your experiences and your expertise. We now have a little bit of time for any questions that have come through. If you have any more questions, you can pop them into the Q&A box or into the chat. My colleague Lula has hopefully been having a little look at what's been coming through. I can see a first question in the Q&A box, which is from Jessica, which says, I have been led to understand that the CRF was for local authorities to bid for and deliver. Are you saying that food banks have the opportunity to bid for some of this fund? Anyone particularly like to come in on that? Tom, you've got your hand up. Please do.
I think it depends, obviously, from local authority to local authority. Some food banks may have already accessed funding from the Household Support Fund, which was running previously. So there'll be opportunities there, whereas you might receive the same amount of money, but you might be looking to do something very different based on the CRF guidance. But those that haven't accessed the Household Support Fund, I think the fact that you are able to, I think there'll definitely be local authorities who are even in the room that are looking at what does cash first mean, how are we going to deliver this. And I think this is a pivotal moment where the local authorities as well need to work with their local food partners to come up with designing what the CRF can look like. And if that's working with local food banks, putting resilience officers in there, helping food banks to transition from giving out food to vouchers, cash alongside support, whatever the system looks like, this is definitely the time for you to start reaching out to your local councillor, whoever the officers are that are delivering the CRF, and whether it's an open application process. That doesn't seem to be kind of what I've seen. It's not like there's an application form out there and you can apply to do it, but I think there'll be conversations within local food networks about how to use this money, and you need to get yourself in that conversation.
Brilliant. Thanks, Tom. That's really useful. And just a brief bit of context, which others might want to add for. So it's expected that a portion of this, it's not a specific set portion, is used for those cash payments during crisis, and that could come through the local authority, or the local authority could commission other, for example, VCS organisations to deliver those cash payments, which might happen in some places. But as Tom said, there's also there's also those resilience building services as a really key part of this. It's not just about the cash payments. So local authorities will be looking at how they fund those resilience services. Sabine, do you want to add to that?
I just wanted to just talk about timeframes here, because the deadline for local authorities to submit their plans for the next 3 years, although they can adapt them, is in fact the 1st of July. So if you're thinking of approaching your local authority, important to do that soon. And every local authority has to deliver a cash first crisis support scheme, and they can decide how they distribute the funding across the resilience building supporting local community networks of support, and the crisis support scheme. But they do all have to provide crisis payments, prioritising a cash first approach. But as we're trying to explain that food banks can benefit from the CRF funding if they're able to demonstrate that they're working towards building financial resilience, they're working towards providing the wraparound services that can help to build the individual's financial resilience.
Brilliant. Thank you, Sabine. Did anyone else want to come in on that, or should we go on to the next question? I can see another question which is around Healthy Start and working with Trussell Trust pantries to promote Healthy Start. That hasn't really happened, and that it's important that we don't forget about the Healthy Start scheme, which kind of links to cash first approaches. Something I would definitely agree with. I can see Polly waving. Do you want to come in on that?
Only to say that I mean, it's obviously really welcome that we've now got the Crisis Resilience Fund with clear guidance about taking a cash first approach. But this is the start of a journey, not the end. And there are so many other opportunities, just like Healthy Start, that give us an opportunity to really think about how you increase income in people's pockets, how you can help people access the income that is theirs and that they're entitled to, but they haven't been able to use. So Healthy Start, and maybe this will give us a chance to look at Healthy Start with some fresh eyes about how we can combine that. Local authorities will be looking at it because their budgets are extremely tight, and so trying to look at how you can pull different bits of money to achieve the same ends is a key bit of what they're doing. So great that Simon's mentioned Healthy Start there. So add that to your list of things that you could maybe draw together in partnerships to support people in your communities. But there are other things as well where you might be trying to support people in the same situation, but without taking a cash first approach, to see how you can bring it all together.
Thank you, Polly. And I've just popped a link in the chat to some of the work that Sustain are doing around Healthy Start campaigning, which includes some kind of local guidance and suggestions. I can see another question here, which says, we're a community hub. Our food clubs brings people into the hub and creates a community, and people then access other support coming to the food club, getting to know us and finding the other services we offer. We have struggled to engage families with debt advice or budgeting planning. I'm interested to know how communities have been built and families engaged without people coming to pick up food each week, if anyone has examples of this. So that's really, I think that's a good question to put out. Obviously, this isn't saying that you can't do food activities anymore. That's not what the guidance says. It says that the resilience building should be put in. But if you're not doing food activities anymore, how do you get people in through the door? Does anyone want to come in on that, Steph?
I guess I would just slightly push back on this idea that your job is to get people in through the door and that you need a kind of a carrot or an incentive in the form of a food parcel to get them through. I think what we've heard really clearly from our speakers today is that we can have the most impact by delivering cash first approaches at the point of crisis and then wraparound support that tackles the underlying issues. And I think if you are working within a community and you see your role as supporting with that, then it's your job to put that on and promote it and provide a warm, welcoming, inclusive space that people feel comfortable. And if you stop giving out food and some of those people stop attending, I think we have to make peace with that. And that's okay. That's their choice if they want to stop attending once you no longer give out food. I'm glad that I can see Tom and Denise nodding. But yeah, I would just question the premise. I think focus on the offer and making it dignified and making sure that it builds resilience and supports people in the most dignified way, which is giving them a choice of how they spend that money.
Thanks, Steph. Polly, do you want to come in?
Yeah, I guess just to say, Zoe, that what we've learned from food banks, and there are some of people who have been doing this within our network who are on the call. So to them, I'm sorry that it's me speaking and not you. But what we've really learned is that you've got to meet people where they are. So the question isn't like what do we need to how do we change what we're doing in our service at our service so people come to us? I'd say go and ask them. Go and ask those folks. What sort of support do you want? Where do you want to get advice? What does that look like for you? Because that has totally transformed how the food banks we've been working with have offered advice and support services. So that would be my recommended first step. Ask those people, where do they want to get that support and advice? What would make it easier for you to get access to that? What have been the barriers before, and how can you do it differently? And it probably won't be at your community hub. It might be about supporting a service somewhere else, or seeing what else can happen.
Thanks. Denise, did you want to come in on that?
I completely agree. When we closed Food Bank in 2022, the initial response was they won't come, but that hasn't been the case. And just like what has been shared, the importance of asking people about what they need and really kind of using that information to lead the design of your offering means that they've been listened to, you are able to meet them where they're at. So for us, it means taking the service to them by doing outreach, making it completely accessible, thinking about who that person is and their needs are. And what we've found over the years is that it then became a word of mouth thing. It worked for me, and if you're faced just like Francis shared, with someone else that that was accessing North Paddington Food Bank, it's worked for me. Come along, they can work for you as well. So I think, Steph, I agree with you. Um, Sometimes you will lose people along the way, but if they're really in need, they'll come back. And I think now is the time for change and it's not about numbers anymore. It's not about numbers anymore. It's about being brave enough to say, okay, maybe you're not ready for this service right now, but there are people that need some help, and we're going to start with them. And eventually, when you build the confidence to come back, we'll be here, no judgment. But for me, it's time for change. We just cannot continue. And I think we need to be ready to kind of make those hard decisions, brave decisions, lose people along the way, but be here for when they come back.
Thanks, Denise. I think that's really useful. And I guess just building on what lots of the speakers have said and what you were talking about, Steph, as well, like different places are going to look at different approaches. And it's so important to look at your community and speak to the community to see what's needed there because changing to doing cash payments might not work in your setting, or it might work in your setting. So we're not saying there's only one way of which you can do things at all. But I think it's really useful for those that have kind of taken a bold step to change things to sort of share how they've done it and what's happened as a result. So for others that think it might work for them to look at that and Sabine, I know you've shared something. I know some people are concerned if they would try and change their model, they would struggle then with funding. And I think Sabine, you've got some resources about how that's worked for other places, haven't you?
Yeah, I was just going to put something in the chat to say that IFAN members have demonstrated that they can bring their donors with them by, explaining what they're doing, sharing the information, explaining why it's important to really meet the needs of the people that they're supporting. So really not convinced. I mean, definitely you can bring your donors with you on this journey.
Right, we're coming to the end there. So we've had lots of great questions. We will look through the chat and the questions to try and see which ones we can apply we can reply to, if any, by email as a written response, as we've unfortunately run out of time. I'm going to ask my colleague Lula just to share our final Menti for you, which it's the same link that you were on before if you've got it on your phone, and we'll leave this up if you have to sort of shoot off. But this is just a question about to you when it comes up on the screen about what kind of support or information or guidance might be useful going forwards, where we might be able to come together with other organisations to try and offer further support, because as has been said, this is the beginning of a conversation, really. It's definitely not the end, and as organisations that are trying to support networks of charitable food providers and charitable food sector, we'd really like to do that. So if you can just go through to the third slide there, Lula. And we're going to leave this up, so you can use that same link or that same code, but would just like to hear from you what would be useful going forward in terms of kind of information and support. And while that's up, please feel free to have a think to reply. I would just like to say a really big thank you to all our brilliant speakers who've come along today. I've really enjoyed it. I hope you have. It's been great to hear from different experiences, and thank you to all of you who have come along. I think we had about 115 people show up, so a huge thanks to all of you. That's been really brilliant. We will share the recording and the slides and some key links that have come through in the chat with everyone, so that will be coming through in the next few days. And yeah, just a huge thank you from me. Thanks so much, and we can stop the recording now.